This is Tracy Pearson recording for Ashley Walker on Trach Care.
Alright, the first thing I'm going to do is look at my order. I want to make sure there's no allergies to latex, which there's not. I'm going to knock. Hi, I'm Ashley. I'm going to be your nurse today. Can I get your name and date of birth? Okay. We're just going to be doing some trach care. We're going to be doing some suctioning, removing the cannula, and cleaning it up a little bit. Do you understand? Any questions? Okay. So I am going to provide privacy. I'm going to wash my hands. And I am going to put on some gloves. I want to look at the skin around and the tube, make sure everything's good, which it is. I also want to note any signs of airway obstruction or symptoms. I want to encourage some coughing to get secretions out. I want to get a respiratory rate and depth. And I'm also going to listen to some lung sounds. Good. Okay, so I'm going to wash my hands, and I am going to go gather all of my supplies. I want to put this over your chest, just in case we have any messes. I'm going to put this on your finger and make sure I note the initial reading for baseline. I want to put on my goggles, protect myself. My patient is already in the correct position. I'm just going to maybe raise the bed for myself. Okay. And so now I'm going to do my sterile technique. You would want to hyperoxygenate your patient before doing any suctioning. Needed. And I did do hand hygiene before I opened any of my sterile stuff. Okay. Alright, and now this is going to be my sterile hand. sure that this is working, so I'm going to suction some of this water. We're good. So now I'm going to insert until I meet resistance. Okay, and then I will pull back 1/2 inch, and I am going to suction. Alright, and I would encourage coughing, deep breathing, hyperoxygenate if I needed to. Always watch for signs or symptoms of respiratory distress. We're doing this 3 times. Okay, and I am going to want to clean out this tube. Okay, we're good there. Put that back on my patient. Disconnect my tubing. Alright, so I'm going to wash my hands, and I am going to put on some gloves. Going to perform some oral care. Okay. Going to remove my gloves, perform hand hygiene, and I want to put on some new ones. Now I'm just going to recheck all of my baselines, well, compare them. I'm going to get a respiratory rate and depth. I'm going to check the pulse ox, and I also am going to listen to my lung skin. Okay, everything's looking good. So I'm going to remove these, and I'm going to wash my hands. We are now going to change the inner cannula. So the first thing I am going to do is set up some of my supplies. This is going to be my biohazard bag. My trash can's over there, but I would lip it. So this is my non-sterile hand. I'm going to remove that. And I am also going to pull this out. Biohazard. And then with my sterile hand, I'm going to pick up the new cannula and insert that until it clicks. Okay. And now I am also at this time going to remove the dirty gauze. Going to perform hand hygiene. And I'm going to put on some new gloves. Okay, you're going to clean in a circular motion. Then you would get a new one. Same thing, circular motion on the faceplate. Get it all cleaned up. Throw it away. Get a dry one. Pat dry. New one, pat dry. New one, pat dry. Alright, so that's all cleaned up. I'm going to remove my gloves, perform hand hygiene, put on new gloves, and we are going to change the ties. It is important that you never remove the old ties until the new ones are on, or unless someone is holding the trach for you. Sorry about that. It's a little difficult. I'm just going to reach behind you for a minute. Pardon my reach. Make sure you can fit one finger under the tie. Remove this one. Make sure the patient, you set their oxygen back to the ordered level. Alright, and you want to make sure you know that their respirations, their oxygen, everything is pretty good, pretty close to their baseline. You want to make sure that they're comfortable, and you want to dispose of all of your supplies as you need to. I'm going to remove these gloves, perform hand hygiene, and put on new gloves so that we can put on the new dressing. We're going to pretend, because I don't know where another 4x4 or a split gauze is right now, so it would just, go right up under there. There you go. And I would again remove my gloves, perform hand hygiene, everything. All my supplies would be taken care of. My patient is comfortable. They're at the lowest position. They have their call light. And I am going to go and document my procedure.